Hey, future medics, now that you've got a lot of this down, let's talk about body positions and surface terms because you're going to use these almost every single shift. So, for positions, we'll start with supine. Your patient is laying on their back like they're laying on a slab of pine wood. Okay? Prone is they are laying on their stomach. Let's turn him back upright. You'll hear left lateral, patient's laying on their left side, or right lateral, the patient is laying on their right side. And you're going to hear left lateral recumbent a lot because it is the recovery position for protecting the airway in patients with altered mental status and nausea vomiting. Next, we have rotational terms, which are for your hands. And so the hands rotate because the radius articulates and it doesn't have a fixed joint. So it allows you to supinate and pronate. So supination is when your hands are up like this, and it's like you're holding a cup of soup. That's how you're going to remember supinate. And then pronation is when hands are down like this, like you're pouring that out. So that's only really used for the hands. You can use it for the feet. EMS doesn't tend to. We don't tend to need to. Now, let's look at surface terms. We use this a lot for burns and injuries. So we'll have palmar, which is obviously the palmar aspect of the hand, and dorsal, which is the posterior side of the hand. This is the dorsal aspect. Also, the foot is the dorsal aspect. So the top of the foot is the dorsal aspect, and the bottom is the plantar aspect because it's like you're walking on plants. So the bottom part of your foot that walks on the plants is the plantar aspect of your foot. Let me teach you two more things to know, and then I'll let you go. I know that learning this language is a lot, but you're doing a really good job. So for a landmark, which is going to be important for you to know, is the midclavicular line. It's not the medial aspect of the clavicle. It's not the lateral aspect of the clavicle. It's right in the middle. And that you traces all the way down the torso, okay? So we need that for EKG leads, listening to lung sounds. Those things are important. And then the last one I'll teach you is the Midaxillary line. It's literally the middle of that axilla area. So it's not anterior, it's not posterior, it's right in the middle. And that line is important for needle decompression, chest tubes, also listening to lung sounds. But that's it. That's all that we're going to do. You are done with medical terminology. You did such a good job. I know it's a lot to learn, but you're going to use these terms every day. It's going to make your report writing more clear and also your handoff so that everybody's on the same page. You're doing a good job. I believe in you, even if you don't believe in yourself right now. I'll see you soon.